Meanwhile, let's talk about Donald Trump and vaccines. Well, they have a rather complicated relationship, as you would know by now. He had earlier declared that vaccines could be bad for America. And now, on Tuesday, President-elect Donald Trump picked doctor and TV personality Mehmet Oz to run the Centers for Medicare and Medicaid Services, or C.M.S. And as the latest addition to his so-called anti-vaccine brigade. On his Truth social media platform, as well as in a press release, Trump announced Dr. Oz's appointment. He said, and I'm quoting here, Dr. Oz will work closely with Robert F. Kennedy Jr. to take on the illness industrial complex and all the horrible chronic diseases left in its wake, quote unquote. But who really is Dr. Oz? What is his story? According to reports, he was born in Cleveland, Ohio, and raised outside of Philadelphia. He received his undergraduate degree from Harvard and a joint MD and MBA from the University of Pennsylvania School of Medicine and Wharton Business School. Oz later completed his surgical training. Besides being a medical professional, he also boasts of a rather successful TV career. He served as a health-focused talk show host for nearly a decade. His show, known as Dr. Oz Show, also won several Daytime Emmy Awards, by the way. He also made guest appearances on the Oprah Winfrey Show, which made him a popular figure on American television. Dr. Oz's association with Trump goes a while back. Oz reportedly first ran for Senate back in 2022 in Pennsylvania with Trump's backing. But he lost to Democratic candidate Senator John Fetterman. In 2018, Trump appointed Oz to the Presidential Council on Sports, Fitness and Nutrition and reappointed him to the position in 2020. And it was during this time that Oz's views on COVID-19 courted a lot of controversy. This included promoting the anti-malarial drug hydroxychloroquine as a way to treat the coronavirus. Not just Oz, Trump was also seen vigorously promoting the use of the said drug early on in the pandemic. While the drug was prescribed to patients by some doctors during the first wave of the COVID-19 pandemic, according to a study published in the February 2024 issue of the peer-reviewed journal Biomedicine and Pharmacotherapy, the pharmaceutical has now been linked to approximately 17,000 deaths. Not just that, Oz's anti-vaccine stance is well known, which includes suggesting a link between vaccines and autism, a claim debunked by scientific research, promoting delayed or spaced vaccination schedules, and featuring anti-vaccine advocates on his television show. While experts deemed Oz's acts as damaging, many from the medical fraternity slammed his opinions, calling them irresponsible and unsupported by science. Oz's endorsement of untested weight loss supplements, which he called miracle cures, also came under fire. However, interestingly, according to reports in the past, Oz had voiced his support for Obamacare as well as backed the Affordable Care Act. That, of course, stands in sharp contrast with Donald Trump's views, and which he now plans to replace with a better version. Now, if confirmed by the Senate next year, before officially taking charge, Oz would be responsible for overseeing the Affordable Care Act exchanges. As part of his stint with the C.M.S, which has enrolled more than 20 million people in 2024, a record number, that's the number of people whose safety and well-being will be in the hands of Trump's picks to lead health care in the country. Like we mentioned earlier, the C.M.S, or Centers for Medicare and Medicaid Services, oversees America's largest healthcare programs, providing coverage to more than 150 million Americans. And Trump's ambitions to reportedly cut waste and fraud within the country's most expensive government agency fuels his onboarding of people, including Robert F. Kennedy Jr. as his Secretary of Health and Human Services, who is reportedly a long-term vaccine skeptic and does not believe in mainstream medicine. According to reports, Kennedy Jr. has a long history of promoting debunked health theories and claims about vaccines, most damagingly about the risks of inoculating children. And what's more, he has promised to dismantle large parts of America's core public health agencies, including the Centers for Disease Control and Prevention, or the CDC, the Food and Drug Administration, and the National Institutes of Health. So what would all of this mean for Americans and their future at large? Can America trust them with their health, or trust that they can handle another pandemic should it ever strike again? To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.